earlier that this is the intensive care unit card. However, you use that you are in the hospital. That is I think the way you have started would be a false start. You have to start this card in this approach that patient is already there. So you need to introduce yourself, and you can tell the patient, "Hello, my name is Doctor Blah blah. I'm a doctor in this intensive care unit at Children's Hospital, and we have been looking after your children, your child. I'm glad to tell you that you brought your daughter in here yesterday with this thing. She has been under observation, and now she has been becoming. Yes, she has been improving. So, if
Yes.
you, I would like to do this thing. That I would like to ask some questions from you. So, if you don't mind, can I?
Okay, sir.
Yeah. So, first of all, can you tell me where she was at the party? And do you remember if she had eaten something or not? You have to ask the question from the patient regarding that. Do not use the medical term. Do not use the medical term
Medical
because
term. Yes.
medical terms are not appreciated. These are medical jargons. Try to avoid them. And secondly, toward this
Yes.
card, as you can see that it has been written that children outgrow the allergy. Outgrow mean
Yes.
like with age they might not have these things.
Yes,
Like
sir.
yeah,
When
so that
children
was
outgrow allergies. Yes, sir.
yes, children outgrow allergy. You said that she would have the problem throughout her life. This is
Lifelong.
not the case. And
Yes.
secondly, as I mentioned, ask you that like in this case, uh, I was concerned that what need to be done as she's in the kindergarten. So you can say that when we identify after the allergy tests, the allergens, we can have
Yes.
the list of allergens that is being provided to the people who are in the close vicinity, who the supervising staff, right, or any adults, so that we can identify any other allergens and avoid
Okay, sir.
certain happening, right? And if it's happened, so we can go for the adrenaline injection. It's a Epipin auto injection, right? So we can use
Yes.
this thing,
Yes.
yeah, right, sir. This is an hospital emergency department setting, and the parent brought her 5-year-old child. Yeah. So here you can see that the patient is anxious. You have to calm the parent down. First, after start, how would you start? We'll discuss. Like after you will do this, find out the circumstances. You will ask that how does that happen, right? And you can also discuss about the first aid and all these things one by one. So please take your time so that we can discuss and give you. This card needs little different start, ma'am, because this is an emergency encounter and patient is anxious. So we cannot start the way it has to be started normally. We can start with say, "Hello, my name is Doctor Blah and Blah. I'm a doctor in this hospital emergency department. I'll be looking after your girl. So can you tell me what happened to her? I can see there are some mark on her face. Is everything all right?" The patient will inform you about the issue regarding the dog bite. So you have to calm the parent down by in this way. So Mr. XYZ, first of all, be relaxed. You are in this at the safe place, and now we are going to examine her and going to give her the right plan according to her issue. So let me show you. You should not be worried about that. So in order to better understand her condition, you can tell the ask the patient like how this had happened. For example, apart from that, did you give any first aid? Okay. So let me have a look if you don't mind. Then we can tell to move on to the next point. Okay, I have examined your kid. After examination, I would like to assure you that like it's just need only to clean the area, and after cleaning it, we have to close it. It's quite simple process. So I'll explain it to you that how can I do it. Clean your wound, right? And then after cleaning, I just close it. Is it clear to you? Do you want to ask me a question? Then the patient will ask you about antibiotics. Then you can tell the patient, Mr. Mark, as in your case, there is very very low risk. First of all, it's quite recent wound, and the face has excellent blood supply. Okay. Then you can tell the patient about the tetanus injection, and also you have to ask about the review after 48 hours, right? And in the last, you need to recommend the patient that it's important for you. You can say next time to supervise their children whenever they will be playing, even to the pet dogs as well, right? You first of all, ma'am, as this is the breaking bad news, second encounter. We can start with the you can say tagging question. Hello, or and it's the
Mm-hmm.
name as I discussed that should be discussed earlier on. Hello, Miss Sarah. I believe today you're here to discuss your biopsy report or camera test report. So
Mm-hmm.
I have I can see from your file that you have bleeding from your back and also had a weight loss and history of loose motion for the last 1 month.
Mm-hmm.
If you have noticed any improvement or your symptom are worsening day by day, this was the first thing that we can see the background. After background, you can go for the
Mm-hmm.
expectation. So, Sarah, what do you think? What could be the possible reason for your worsening of symptom? Then you can move on. Do you want to call someone, maybe your spouse or anyone, your
Mm-hmm.
family? Okay. So, Sarah, like in the past, did you ever encounter or handle the medical reports, let's say? And what was your experience of handling them? For example, we can also move on and tell the patient this thing. So, well, I have Sarah actually. Can we discuss in here or can we move to private? And then you can tell the teaser, well, Sarah, unfortunately, I have some serious news. And when you will be breaking the news, you can break in this way. Well, recently your biopsy confirmed that there is an excessive growth, an extra mass attached to the lower part of large intestine in the layman
Mm-hmm.
language, right? Uh, then you have to give the patient some time and ask the patient, so have I made myself clear? Do you want to ask any question? Okay, if you don't have any question regarding the procedure, I would like to move on toward the treatment. So, in terms of treatment plan, we will be referring you to the surgeon on an immediate basis.
Mm-hmm.
So, as per the extent or the spread of the tumor, they would decide to move on toward the further method of
Mm-hmm.
chemoradiotherapy. But as for your consent, right?
Mm-hmm.
Yeah.
And if
Then,
she say that I don't want these
yeah.
remedies.
Yes, she mentioned that I don't want this chemoradiotherapy. You have to first assure the patient. Well, first of all, Sarah, let me assure you that and we cannot go for any procedure without your consent, right?
Mm-hmm.
So, it's something that I would like to ask you. Do you have any bad association or like bad reaction with this chemotherapy, for example? You can ask this thing from the
Mm-hmm.
patient. Okay. So
Mm-hmm.
then the patient, I'm sorry to bring that feeling again for your aunt. So first of all, it will be purely your call to go for the chemotherapy, right? However, there are a lot of benefits associated with chemo and radio. I will be discussing this thing for you with you that there are like there are some pros and cons of the chemotherapy and a lot of benefits of that. Still, it will be your choice, and further you can discuss with this person, right? And rest of the 2 points was discussed appropriately. This card setting is operation theater suit, and the patient is waiting for the surgery, and they have called you to discuss about the this lipoma. Okay, so you have to assure the patient the risk of cancer is quite low. It means that after having some basic inquiry from the patient will tell you about the risk of possibility of having cancer. So you have to show that it's not a cancer. Then you can tell the patient that after examining this in the microscope in 2 weeks' time, you will have an idea the nature of the patient, right? And the patient will tell you that she is anxious about the cancer. Then you have to ask the patient what is your understanding about the lump. Then explain it. Basically, it's the accumulation of fatty tissue, right? So it's a normal condition. In medicine, we use the word as benign. I'm sorry for the medical term, but it do mean that it's a you can say a normal condition. It's not a cancer. I can see from the you can say file that you have been booked for the outpatient clinic to pick the report after 2 weeks. So they are taking time so that they can understand what the problem is, and after that they would have an idea uh, about the like the nature of the lump, and mostly in this case, as per the clinical picture, it's clear that it's not a cancer. However, the report will be a confirmatory thing when you have discussed appropriately about the this point, and secondly this as well, right? Earlier,